Sir, myself, sir. Myocardial protection, sir. It is also known as myocardial preservation. Definition: it refers to a set of pharmacological strategies either to attenuate or to prevent post-ischemic myocardial dysfunction that occur during or after a post-cardiopulmonary bypass or any cardiac surgery. It depends on what physics we used and how separation from cardiopulmonary bypass, adequacy of surgical repair, and any hemodynamic instability in early post-op and pre-op. The myocardial preservation done during pre-op, intra-op, and post-op. Pre-op factors are pre-op hemodynamic instability or any arrhythmias or any ischemias. Intra-op factors, if any hypovolemia, any hypotension, any tachycardia, or what anesthetic technique we used, or any patient went on pump or off pump, inadequate ventilation, or direct manipulation to the procedure. Post-op factors, maintain coronary or any adequate ventilation and avoid vasospasm. Goals of myocardial protection, sir: it provides quiet bloodless field and avoidance of substrate depletion like ATP, mild to moderate hypothermia, and rapid induction of arrest. Mechanism of myocardial ischemic injuries are myocardial edema, intracellular acidosis, depletion of ATP, direct myocardial injury from ischemic events. Cessation of myocardial blood flow occur in mitochondria and cytosol also. In mitochondria, depletion of ATP leads to oxidative phosphorylation stops. In cytosol, anaerobic glycolysis stops when the depletion of ATPs. If depletion of ATP is more than less than 50% of normal level, irreversible lethal cell injury has happened. So, protein denaturation can occur, and structural enzymatic nuclear changes can occur. Glycolysis is blocked, and increasing cellular acidity. Factors contributing reperfusion injuries are calcium influx into cells and generation of oxygen free radicals, neutrophil activation, and complement activation. How to minimize the reperfusion injuries? Controlled reperfusion and giving mannitol and decrease extracellular calcium and addition of oxygen free radicals like superoxide dismutase. This manifestation of reperfusion injury, endothelial dysfunction, myocardial edema, and myocardial cell death, and post-ischemic systolic and diastolic dysfunction. Cardioplegia, the cardioplegia is temporary arrest of the heart, giving solutions like crystalloid and blood. It is the most common we are using is crystalloid solution. Potassium is the most common chemical cardioplegia, and it is giving a temporary cardiac arrest for 15 to 30 minutes. And it can the extracellular potassium concentration increases. It can also increases the voltage at phosphodium channel, and the slow calcium channels is also activated during the diastole period. Hibernating myocardium, the metabolic process remains intact, and chemically dysfunction myocardium and resting blood flow is decreases. Whereas standing myocardium, the function of the myocardium remains impaired, that is, even though the resting coronary blood flow is unaffected. So, but full recovery is expected. Ischemic preconditioning, it is a natural protective mechanism where brief periods of ischemia followed by reperfusion protect the heart from subsequent or more prolonged ischemic events. It reducing the infarct size and impairing the post-ischemic function. That's all.
Okay. So that is a very common problem for cardiac anesthetists, how to protect the myocardium during cardiac surgery. So this is those who are planning to become cardiac anesthetists in your later life should read more about this. Otherwise, for exam sake, if you learn what is happening, it's more than enough. So, preventing permanent damage to the myocardium during cardiac surgery or after the cardiac surgery is what is called myocardial protection. That is all the simple definition of myocardial. How it can be achieved by from the pre-operative to intraoperative and post-operative time is the way that you have to answer this question. Okay, so some full some preoperative conditions or existing comorbidities. All of them are likely to produce myocardial dysfunction due to ischemia, both during intraoperative and postoperative. So proper selection of cases, anticipation of the presence or likely occurrence of myocardial ischemia, and then managing that or preventing that by proper steps that have to be followed is what you are expected to write as an answer for this question. And of course, you have done a good job for that. I will just go for presentation to share